that means that everybody, we're going to invite you to be part of this conversation, which will be taped and posted on our webpage, right? So that we can have this resource for future folks in the community. This is really a resource about how businesses can take advantage of tax credits to employ people in recovery and therefore become more recovery-friendly businesses, and also for folks who are in recovery who can engage with employers and with some of the organizations in our community that are trying to support them as they get stable jobs to help in recovery. We've known for a while that a good job or a steady job is super important when you're in recovery. My name is Julia Reischel. I'm the co-chair of the Catskills Addiction Coalition, and I have a star-studded cast with me today. This is kind of awesome. So I'd like to introduce Dean Hale, who works at OASAS, which the name of OASAS, Dean, I like never spell it out anymore because they changed what it stood for. Can you tell me what it stands for?
Yeah, now it stands for the Office of Addiction Services and Supports.
Dean is a training specialist too, who oversees the Recovery Tax Credit Program at OASAS. And he's going to be giving us a presentation for really aimed at businesses about how to engage with this new incentive. We also have Carol Laverne, who's the executive director of the Central Catskills Chamber of Commerce, Glen Pederson, who is the vice president of the Central Catskills Chamber of Commerce, and Dennis Morgan, who is the certified recovery peer advocate at the Catskills Addiction Coalition. We have a few ground rules before we start. This is a participatory event. We really want you to engage and ask questions. And feel free to unmute yourself and jump in. I will also be monitoring the chat. If you want to put a question in the chat so that you're not interrupting, no problem. I have no problem with interrupting. That's my job. We are engaging in the spirit of accountability and collaboration, right? This is a new program that Dean's going to be talking about, and we're all kind of learning how to implement it together. Also, the concept of a recovery-friendly business is a new one in the Catskills region, and is something we're doing together. We're sort of building together. Carol asked me before we started first I should say there will be evaluations of this session. I'll post links in the chat box, and also you can get a certificate of attendance, which is awesome. For latecomers, it's being recorded. And Carol asked me before we start to talk a little bit about what the Catskills Addiction Coalition has done and what we are offering to the community. We are located in Margaretville. The Margaretville Hospital is my main employer. I wear two hats, right? So I administer something called the Rural Communities Opioid Response Program out of Margaretville Hospital. And we work in close partnership with the Catskills Addiction Coalition to offer a wide variety of services in the region. They're mostly human services. Dennis Morgan is one of those people that we're employing, who's available for peer counseling and also advice about being a business or being a person in recovery who wants a job locally. Also, he's a person in recovery himself, and so can offer support and coaching to folks who find themselves in recovery. This is the first peer who's been based in Margaretville yet, and this is something we've long wanted, so we're really excited about that. We have an additional peer named Alicia Griffin, who isn't on this call today, but she specializes in supporting parents. The Catskills region has one of the highest rates of neonatal abstinence syndrome in the whole state. And so we have a special grants, the root causes behind that high rate of neonatal abstinence syndrome. We also have a parent pantry located in Margaretville Hospital where you can get diapers and baby formula. We offer walk-in counseling services. Both Alicia and Dennis are on call here. We offer linkages to doctors who provide medication-assisted treatment. If you are struggling with substance use disorder, we will soon employ a wellness coordinator who will be available for anybody in the region who just needs a hand getting from point A to point B, navigating substance use disorder and treatment. We do a lot of other things, but the point is that we're trying to coordinate as a coalition all of our services to serve people who use drugs and people in recovery and people with substance use disorder in the Catskills. That's a long blurb. I'm done. I'd love Dean to talk about the Recovery Friendly Businesses Program, the Recovery Friendly Tax Credit. You're going to say what it's actually called, and he has a PowerPoint to get us started. Take it away, Dean.
Thank you, Julia. Thanks everyone for joining us today. I'm going to share my screen. So the New York State Recovery Tax Credit. Again, my name is Dean Hale. I'm a training specialist with New York State OASAS, the Office of Addiction Services and Supports, and I oversee the Recovery Tax Credit Initiative. So with that being said, New York State now is the first state in the nation to offer a recovery tax credit program for eligible employers who hire eligible individuals in recovery from a substance use disorder. We've been given the opportunity to essentially give away $2 million, which will be available annually beginning the calendar year 2020 for eligible employers. And that breaks down to up to $2,000 per eligible employee, which I will tell you what an eligible employer and an eligible employee is, those definitions. Credit certificates will be available from us for the 2020 tax year returns submitted for 2021. So the definition of an eligible employer. An eligible employer must pay corporate finance tax. They must submit the RFA to OASAS, have a documented working relationship with an OASAS certified outpatient program. And I'll talk more about that. Basically, that just means an employer knows if and when they have an employee that's been identified as someone in recovery from a substance use disorder that needs to re-engage in services, they know where to send them. And perhaps they have an employee that hasn't been, self-identified as someone with a substance use disorder that develops one, also to refer that person, basically just knowing your programs in your community. And also assisting individuals in recovery with the hiring process and provide training for employees and supervisors. So that can be something as simple as a person in recovery. This may be a first job, quote unquote, on the books, and they may need help filling out tax papers. Definition of an eligible employee continued. They must be in recovery from a substance use disorder. They must attest to completing treatment in a OASAS certified treatment program. They have to have been hired on or after April 12th, 2019, work a minimum of 500 hours and remain employed on January 1st of this year. They don't have to be employed still today. Those are just the two dates that matter. Hired on or after, April 12th, 2019, and still be employed January 1st of 2020. The recovery tax credit breaks down to $1 per hour worked. It's a minimum of $500 and a maximum of $2,000 per eligible individual. The maximum amount which OASAS may issue in a tax credit is $2 million annually. So essentially, one employer could get the entire $2 million tax credit. Obviously, that's not our intent. There's plenty to go around. So the question, if a tax credit exceeds the taxpayer's tax for a taxable year, what happens? The credit will be treated as an overpayment and credited or refunded to the taxpayer. And of course, there's no interest to be paid on the tax credit overpayments. Some additional requirements, which I and OASAS will help you fulfill. Training requirements for employees where eligible recovery tax credit employees work. How to support a recovery-friendly workplace. That training will be for all employees. So Julia kind of touched on that. Utilizing the employee assistance program. That training would also be for all employees, all staff. If your business has an EAP, if not, some resources that people could utilize for support. And again, if your business has an EAP, utilizing formal EAP supervisory referrals. And that training would just be for supervisors and administrators. Some additional requirements, health insurance requirements, if offered, benefits must include substance use disorder and mental health coverage. If insurance is not offered, employees must be given information on how to access coverage on the New York State Health Exchange. If employees are not insured, they must be informed of a sliding scale services for substance use disorder services. The recovery tax credit application can be found at this link or through our website, which is oasas.newyork.gov. You click on that in your search engine. It'll take you to the main page and you will be able to scroll down to the recovery tax credit section of our website. So the application process, briefly, I'll go over that. You fill out an application for preliminary approval, contact information in all locations participating in a program. And that's found on page 6 and 7. I'm actually going to show you what page 6 and 7 looks like to show you how simple I think we've made this for businesses to take advantage of this. So here's page 6. You can see the employer fills out their name, their tax ID number, their address, street, city, zip, the CEO's name, the phone number, the email address, the recovery tax credit contact name. That may be someone different than, you know, the CEO. It could be somebody in human resources. We have a few folks in businesses that have applied for the tax credit, and our contacts are their human services or, you know, their accounting department. And again, just basic information. Page 7, the employer name. Again, this is if you have additional locations. We actually are working with a business right now that has more than one location and has more than one tax ID. So they are a substance use disorder facility under one umbrella. They have 2 businesses with multiple employees that they're applying for. So when that happens, you would use this page as well. The application process, agreements on files, letters signed by both parties on page 8. I'll show you what that looks like. An OASAS outpatient clinic, that is required. So again, the eligible employer knows where they can get support and services for their employees. Optional, an OASAS funded peer navigator, family navigator, or an OASAS funded or other community-based recovery center. It could be a clubhouse. There's lots of programs out there, but again, the only one that's required is the OASAS program. So again, here is that page, you know, and we actually give you links to find OASAS funded recovery services locations in your area. So regardless of where you are across the state, you can click on this link and it will tell you within a 5, 10, 15, 20, so on and so forth, mile area, the programs that are OASAS funded that you can utilize for services. Also outpatient clinics, we provide a link for that as well. Substance use disorder resource agreements found on page 9. It just simply attests that there's agreements on file. Current eligible employees fill out page 10. Eligible employee application, page 11. This should be completed and signed by each eligible employee and submitted to us as well, because not only is there forms in the application that the employer will complete, but there's also forms that the employee will complete as well. So these are what some of those pages look like. Again, employer's name, fill in the blank. I attest that our business has a relationship, knowing relationship with this outpatient clinic. That gets checked and you say, hey, for example, you know, in the Catskills, we are familiar with Twin County Recovery Services outpatient. Enough said. Real simple. Also going back, if the business has an EAP, we would like that documented as well. So then here we go. The employee's name, when they were hired, their job title, whether they work full-time, part-time, or per diem, and the number of hours. And this helps us calculate the extent of the tax credit you will get. The eligible employee application continued. Again, basic information, employee name, address, their title, their hours worked again, and then the name of the most recent treatment provider program they completed or are currently attending. It doesn't matter if the eligible employee attended a program 5 years ago, 10 years ago, 15 years ago, doesn't matter. OASAS will respond to preliminary and additional employee forms and applications within 30 days. That's something I will do. Once we give an employer approval, we'll send a preliminary approval letter. We've sent some of those out. Preliminary approved employers will be tracked, and then we send out a request, their tax credit certificate from us. So that is the process that I'm in right now with some of the businesses that have applied for the tax credit, sending out their tax credit certificate, and the recovery tax credit form will be processed, and OASAS will issue the tax credit certificate so they can submit that with their taxes. Lastly, I ask that you share this information with others in the community that may benefit from this program, personally and professionally. If you have friends, if you have relatives that have a business, pay corporate finance tax, coworkers, we want anyone and everyone that is eligible to take advantage of this tax incentive to be able to. And thank you for all of your efforts in helping us ensure the program is a success. Again, the tax credit application can be found on our website, oasis.newyork.gov. You'll see a spot for recovery tax credit. Questions will go to me, and this is an email address that I oversee, recovery.tax.credit@oasas.newyork.gov. So that is a brief overview of the first in the nation New York State Recovery Tax Credit Program.
That
Great,
was awesome.
great. Lots of information in a short period of time.
I'm getting used to it.
Julia, I have a question.
Mhm.
Dean, how many businesses presently are in this program?
Right now, we have 3 signed up, and they are all substance use disorder programs, for example, that employ folks in recovery. We have some peer advocates that are eligible employees. We have a nurse that's an eligible employee, recovery coaches. So again, right now we have 3 employers. One of those employers has 2 sites.
And just out of curiosity, where are they located? What part of the state?
They're all 3 of them are downstate, actually.
Downstate.
Yep.
What is a peer navigator?
I'm not sure if Dennis would want to speak on that. A peer navigator is someone that can help someone navigate through the process of recovery. So peer is just what it sounds like, someone that is a peer that will assist. Often it is recovery coaches, it could be peer advocates, and I'm not sure Dennis may be able to speak more on that as well.
Thanks, Dean. Yeah, in my capacity, we could be talking about anything from helping somebody do a resume to helping them with their substance use disorder to helping them with rides or helping them at least become familiar with mass transit. A peer advocate or peer navigator is kind of a mix of typical AA sponsor, a friend, and a counselor all rolled into one. We are concerned with helping them in any aspect of their life that might enable them to move forward. So it's not restricted to the substance use recovery, so to speak, but it would be anything that would help them. And in this case in particular, anything to do with employment as well. So.
I don't mean to dominate this, but I have a couple other questions, if you don't mind. One of them is, how many employees does a business have to qualify for this program?
One.
Yeah.
I mean, how many, let me just rephrase that. All they need to apply for the tax credit is 1 eligible employee. So it could be a business that literally employs 1 person that's eligible. It could be a business that employs 200 people and 1 person self-identified.
I was thinking about a landscaper or something that might be starting out or whatever, you know.
Absolutely. Yeah.
Dean, I just want to make sure in our previous discussions, did we decide that a sole proprietorship by nature of that corporate tax thing was not eligible?
Well, you know, that's a great question. Again, I would encourage folks that are interested in applying for the recovery tax credit to actually reach out to me individually, because sometimes some information has gotten mixed up. Some folks that didn't think they would qualify do, and some folks that, you know, thought they would qualify actually don't. So again, I don't want to paint with a real broad brush. You know, look over the application, and I'm more than welcome to, you know, and happy to walk someone through it, you know, step by step.
Last question. Do you have, do the employees, do they have to work full-time or can they work part-time? I know they have to have a certain amount of hours to qualify, but
yeah, absolutely. Doesn't matter if they work full-time, part-time, per diem. The minimum hours they work to be eligible is 500. The max is 2,000. And I'm glad you brought that up, because that's something also that businesses need to be aware of. Now, the deadline for this tax year is, coming up Friday, the 15th. So if somebody can get a RFA into me by Friday, we can look at it and it can be approved. Like I said, we have some, but also when businesses are considering that, if they're considering this year, they really need to look at and estimate how many hours that employee has worked, because I would encourage businesses that if they have an employee that's only worked 510 hours, but by this time next year, they'll have worked well beyond the 2,000, I would encourage them to wait till next year, because you can only get the tax credit for an employee once. So I would want that employer to get the most incentive that they could.
Good. Very good.
Dennis, I have a question about, you have been visiting businesses in the Margaretville area. Can you talk to your experience so far? You don't have to tell us who you've spoken to,
Sure.
but just how you've been received.
I've been received very well. In particular, every business so far that I've visited has expressed a desire to continue to employ people in recovery, which is awesome. The time constraints and certain other constraints with the tax credit made it so that so far I haven't been able to submit anything to Dean, but all of them have been more than satisfied with the employees that they have that are in recovery, and expressed the interest to continue to work with me going forward. So it's been, I think as we go on in this session, that's one of the things that becomes important, is that a tax credit is awesome. However, there are several other reasons that an employer might want to employ somebody with a substance use disorder.
Mm-hmm. Yeah, and I will say from the Chamber's perspective, why we are embarking on this is that we do have this opportunity to help people get back to the kind of life that they have as a goal, that they want to improve their lifestyle, they want to do a better job with their family. They want to become a really positive influence in their community. And we've seen so many people who are really struggling that the businesses and the community at large really need to step up to the plate and be here for people who are in recovery and give them that support that will make a difference in their lives. So that's why the Chamber has gotten involved with this, and we're committed long-term to be involved with this. We are so grateful that we have Dennis working with us and Julia and the Catskill Addiction Coalition. They are really our foundation for moving forward. So call us anytime.
We have an awesome question in the chat. Casey, if you want to unmute yourself and ask it, be my guest. Or I can read it, but it'd be great to have it in your voice.
Well, sure. So I'm just wondering, this is amazing. I absolutely love it. And I, can think of some businesses that it would be very, that would be all about it. But for those business owners that might be a little hesitant to take a chance on somebody in recovery, is there anything beyond this awesome tax credit? But from what I understand, it's $1 an hour, right? So is there any kind of further assurance, like say they hire somebody and then they put, 20 hours, invest 20 hours in this employee and training them, and then they just don't show up again. So now the tax credit, then they get $20, right? But if that,
No.
Are there any assurances in place for these businesses at this point?
Cassie, if I can, first I would say the employee would have to work a minimum of 500 hours. So I'm glad you bring up relapse for several reasons. And I'll just point this out also. If an employee has a return to use, a relapse, as you say, that doesn't affect the tax credit at all. The point of having a working relationship with an outpatient program is to provide those services. And I'll just say this also, and I'm sure Dennis can speak on this. And there's a great pizza place called Sal's Pizzeria. And this, the owners exclusively hire folks in recovery. All of the people that are eligible employees are going to be self-reporting that they're in recovery. And I'll just say this, you know, as an employer, I would rather have an employee that I know is in recovery than have one that I don't, that should be. Anytime someone's hired, there's a risk. But again, we're there to support. That's why we like employers to have a connection with a peer navigator, family support, recovery coaches, and have that relationship with an outpatient program. So if and when that does happen, it's not the employee just disappears and doesn't show back up to work. We want a recovery supportive workplace to continue to have that employee engaged in services that are needed and employed.
And if I could add also, kind of in that same vein, in talking with one employer in particular in the area, his experience is that the people that he's hired in recovery have been more dependable than anybody else that he's hired, and they've been more grateful for the opportunity. So along the lines of what Dean was saying, and I did a lot of research just trying to get, you know, numbers to back up what we're talking about. And one in particular stuck out to me was that one of the studies by the Department of Labor, this happened to be for Connecticut, but it was that 70% of the people in the workforce are actively using drugs and alcohol. So just because you're not, you know, so like Dean said, would you rather have somebody you know is trying to be in recovery, or take the chance that, you know, they're one of the other 70% that you're going to have to worry about not being willing to work on themselves? So I can tell you, and I'm going to embarrass my wife right now. The other part of that is that when we started this session, my wife started crying because my life in particular has changed immensely through the process of recovery, but also because the people on this session in particular have given me an opportunity to not only have a job, because I think that, you know, in one fashion, that's relatively easy to find a job, maybe not always, but to have a job that also builds my esteem and addresses some of the other areas that are so important for somebody in recovery, and if they want to move forward and become a better employee. So
well said, Dennis.
Great.
We have another question. Jane, do you want to unmute yourself and ask?
So this is for Dean. Is there a sense that the tax break rules are going to loosen up to be more inclusive for smaller businesses that are not that aren't in the corporate, you know, like for the little landscaper who's probably definitely not paying corporate tax. And I'm just thinking of, you know, like some of the shops on Main Street anywhere, New York, you know, not a lot of those are paying corporate tax, but could really benefit from those tax breaks, but just from that, also just that relationship with maybe having a positive relationship with taxation. But in all seriousness, like it just seems like it does kind of eliminate a whole lot of small businesses.
We found actually some of the businesses have been those folks that have reached out to us, and some of the snags that they've run into was they hired folks prior to the April deadline. The legislation is written how it is written, so I can't imagine that it is going to quote unquote loosen up. Unfortunately, there are a lot of employers out there, not only you know, the ones you referenced, but also non-for-profits, which can't take advantage of this tax incentive. And I think the other side of that is also, although, you know, I oversee the tax credit, the bigger picture to me is establishing a recovery-friendly workplace. And that's another direction that we're going to be looking at as well. But again, unfortunately, the legislation is written how it is. So it's spelled out unless you pay a corporate finance tax. And I personally know of a non-for-profit agency, for example, that has 80 employees that are folks in recovery. This non-for-profit has actually considered changing to a for-profit to take advantage of this because it would be so beneficial to them.
Well-
Gail Lindstrom asked, oh,
Okay.
there's a question, Carol. Gail Lindstrom asked if there is a video of interviews with any employers talking about their positive experiences. I know, Dean, you were working on one. What happened?
Still working on it. We normally record at a studio in the Empire State Plaza. With COVID, that's kind of changed things. I would encourage you to watch the video that Sal's Pizzeria did. It's a great example of their experience and how they've benefited from it. And again, like Dennis says, I know folks in recovery, you know, like Dennis says, are more appreciative of jobs at times. They may be more, dependable. You don't have to worry about them, the day after the Super Bowl, the day after New Year's Eve. It's good to become part of the solution. No one can deny that there's not an epidemic. So this also gets people involved in establishing a recovery-friendly workplace and community, even if they can't take advantage of the tax credit.
Well, and I
I
would
put a
think
link to the
that-
trailer.
Excuse me? Go ahead, Julia.
There's a link to the trailer of that video about Sal's Pizzeria in the chat if you want to look at it.
What I was going to say is that we have an opportunity. We know what things are set up on the state level right now, but because we're in a rural area and there are a lot of rural areas with small businesses throughout New York State, that there's a story we can tell that might influence how the program is offered or who actually gets tax breaks. But I think often in rural areas, we kind of get left at the back door because we don't have the size of the business that would be in more of a suburban or urban area. So I would say we just have to keep documenting all of this and seeing what works and what doesn't for us and try to make a change so it does start to work for us. Just don't accept what's now. That's my motto.
Work for change.
Yep.
If I could, another thing I wanted to talk about that has been talked about a couple of times in some of the sessions here is the idea of stigma. So I completely agree that relapse is an issue with people in recovery oftentimes. Where things get interesting, and it might be a stretch, is that if somebody had a different kind of medical diagnosis and they had a relapse of some sort, that employers wouldn't think twice about supporting them and helping them with their medical procedures, et cetera. But you bring in the question of addiction and the stigma attached to that, and all of a sudden it's like, oh, these are those people, these bad people that have let us down. And I understand the stereotypes. I've been one, but I think it's important to acknowledge that in a perfect world, at least in my mind, it wouldn't be treated any differently than anything else. And one plug from anybody that's on the call is I've been having great success in talking to employers. Where I would love some help is finding people to fill the jobs. So it's great if we have employers that are willing to hire people in recovery. Now I need, with all your help, to get the connections to find the people that want those jobs. So thank you.
Mm-hmm. And we're also in a really difficult time right now with COVID. And so to lay the groundwork with Dennis's support and Dean's support, I think is critically important. And I'm really appreciative that this is being recorded and that it will be available for the public to take a look at. And it's a resource that Dennis and I and Glen can share with our membership to take a look at it at their leisure, and then they'll be able to come to us with more specific questions.
Carol, I think that's a great point. We started, and I started overseeing this initiative in February, and then a month later, we find ourselves in a position of COVID, and there were, layoffs. I think we will be in a lot different position this time next year. That's my hope. And my hope would be to be able to give away the entire $2 million this time next year.
Mm-hmm. Yeah, we have a lot of seasonal businesses. I think of Bel Air and the ski centers. You can definitely put 500 hours in during a ski season. And that's an opportunity. We've talked to Bel Air about getting involved with this, but they have a lot of problems right now. So we'll be able to continue with that conversation.
So we have about 15 minutes left. Actually, 20 minutes. We're not too bad.
I have a question for Dennis. It's more about recovery. I think it was last Friday when they were doing a 3-hour program in the morning, and they were talking to people who were in recovery, and it seemed all of them were on a particular drug that seemed to, they were just so pleased that they finally had something to help them through with this that actually worked. Can you tell us a little bit about this drug? And were you ever involved with that?
Actually, I did not see the whole 3 hours of the kickoff, but I'm assuming we're talking about Suboxone.
Buprenorphine.
Yeah, buprenorphine. I have no experience with it. I know several people in my circle that are using it as a medically assisted treatment tool. I was not in need of any medically assisted treatment, in large part because of what my drug of choice was. So I just, through personally, my thing was AA, NA, and some therapy. Went for abstinence, but that's very common with my drug of choice.
But this drug seems to be very, very helpful to people, especially the ones who we're talking to. So, I think, I don't know, I felt very hopeful for them. And it seemed to me that the recovery was really on a positive plane for all of them. And I just wanted to know a little bit more about it.
Yeah, I apologize. I don't have personal experience, but in my circle of friends and associates in recovery, by and large, probably 90% or more would be positive experience with that process. It's definitely helpful to the people that I know, and it's just. Again, it's the stigma thing. You don't think about taking insulin to help your diabetes. So when people are able to have something that helps them change their life dramatically, it's kind of a no-brainer to me. But maybe somebody else has more personal experience. And Julia, that's one of the things that we are able to do at the Catskill Addiction Coalition is to help people be connected to prescribers so that they can at least try that.
Absolutely. So I should say, Glenn, that the reason everybody who was speaking was so happy about buprenorphine is because I asked 2 local buprenorphine doctors to ask any of their clients to talk to us and go on that, on the session on Friday. So it is a self-selecting pool. And it is important to note that bup is just one of the many ways you can do recovery. It's a great way. It works for a lot of folks, and it also has some stigma attached to it, particularly in Delaware County, which is why we highlight success stories of buprenorphine use. Buprenorphine is the generic name for Suboxone, which is one of the trade names of the drug. It has stigma because folks worry about it being diverted. Law enforcement folks are often pretty suspicious of it. They see a lot of illicit, illegal buprenorphine being used on the street. One of the things I like to say about that is that means that people are using it to not use heroin on the street, which is great. So I just want to provide context for that.
Right.
You definitely got the message that bup can be awesome. I just want you to know that some people don't do buprenorphine assisted treatment for recovery, right? Dennis is one of them. Right. And that's great. We like to have all of these different, many pathways to recovery represented.
Great.
Dennis, would you talk about Samadhi and what resources they provide, your relationship with that organization?
So I'm actually employed by Samadhi, who contracted with the Catskills Addiction Coalition to have me be a peer. Samadhi is a recovery outreach center in Kingston, New York. And they do a variety of different things. It's kind of the CEO is David McNamara, and his vision is to catch the people that none of the other programs are servicing. So we offer meditation, something called Refuge recovery meetings, which is a different type of, similar to AA or NA meetings, Tai Chi, family programs, programs for people that are in this field that need to take some self-care. They offer a special program for that. But they're very similar kind of to the Catskills Addiction Coalition. They are interested in helping people in any way that they can. They're client-centered, meaning they come in and like Glenn was just talking about, if they say they want to be abstinent, we can help them with that, and we can help them get into rehab. We can take them to meetings. They say they want to be placed on medically assisted treatment. We have the connections for that. It might be as simple as taking them to medical appointments, taking them to DSS, feeding them, letting them take a shower there. Pretty much soup to nuts. They come there I guess that in my mind anyway, it's to love on people and see how we can serve them, because everybody's goals are not the same. I made that mistake early in my recovery and was kind of like, well, this is what works for me, so everybody must do what I do, which is now I see kind of crazy. So yeah, Samadhi is very similar to CAC in that we just want to help people achieve what they want to achieve.
Great. So it's a great resource to encourage people to use their resources.
Yes, and they are in Kingston, but almost every group that they have is also offered on Zoom. And they do have a pretty significant network of peer advocates, so that especially now with COVID, it's actually beneficial because not a lot of people are meeting in person. So even from Delaware County, if we are able to reach out to enough people that need to be placed with peer advocates, they can be there. I think there's more than 40 peers that are available for people to talk to. So we can connect them based on age, based on drug of choice, based on a variety of different things. They kind of get to pick whatever qualities they want in a recovery coach, and we can, through Julia, help make that happen.
Julia, yay.
Yeah, we're all about connecting. Dennis also is a great connector. That's why I have this job. There are all these resources. Look at the ones arrayed in front of us. But it takes time and energy and folks to just connect each other and learning about it. The idea, Carol's been working on creating this recovery-friendly business community for 2 years now, Carol, year and a half.
Mhm.
Yeah. And we kind of have businesses that are doing this already, right? Dennis has talked to some. I talk to businesses that say that they're employing people in recovery and are thoughtful and intentional about it and want to create a recovery friendly business. We have
Right.
some businesses that I know that employ only people in recovery, but they aren't doing this way, nor are they necessarily public about it because, say it with me, stigma, right?
Right.
So we're trying to destigmatize the supportive, loving community that we're building together. And we're so grateful for the connections that we're building. Anybody in the audience, any other questions, any other ideas for businesses to hit up or take away like this information and tell your friends who run businesses about it. Tell them to get in touch with Dennis. Tell them that we want them.
No questions. You know everything.
They know everything.
Yeah.
I actually have a question for Dean. I have spoken to at least 3 companies that I know of that, at least as far as what you've taught me in terms of being eligible for the tax credit, they are. And maybe it is stigma, but for some reason, they just do not want to apply for the credit.
Whoa, that's so interesting.
Yeah. That's, it's been no shortage of trying. I've reached out to every single chamber of commerce in New York State. I've presented at some chamber meetings. I've spoken to some major household name corporations. And you're right, it's stigma. And I can go in and explain, hey, this is a self-reporting, eligible employees are self-reporting that they're folks in substance use disorders. No one's saying, hey, put all your employees in the break room and say, hey, who's an addict? Who's in recovery from a substance use disorder? But again, it has been the bigger corporations definitely have turned around and said, hey, look, this is just not our thing. How are we going to track it? We've got 2,000 employees. And you have to respect that. Some people are open about recovery. Some people aren't, and hopefully with the continued work towards reducing stigma, because I can't imagine that anybody doesn't know at least one person that has a substance use disorder. It's caused problems in their life, or someone in recovery, but yeah, it's still such a hush hush. And we just can't stop plugging away. We don't give up. So again, folks want to take advantage of it. That's great. If they don't, I don't push it down their throat. Change your mind. Let me know. It's not going anywhere.
Well, and one of the ways to bait the hook on this, at least from our perspective, is if you're in recovery and you need a job, we're just sort of quietly networking with businesses on your behalf, right? These conversations, even if the business doesn't then go ahead and do the tax credit, they might. I mean, I know that some of the businesses Dennis has talked to have been like, hey, do you know, like we really need to employ folks, and that's great, right? Like that's a thing that can be tangibly beneficial.
Yeah, and employers have turned around and said, hey, what's in it for the employee? And I've had this conversation. For folks that are in recovery from a substance use disorder or currently in treatment, it can be, whether it's drug court or treatment, what have you, it can be very discouraging and intimidating to go out into the community and try to find a job. Because before you even interview, you need to have that conversation. Hey, I need Monday off to go to drug court. Hey, at any given moment, drug court, my probation officer, my parole officer can call me and bring me in for a urine drug screen. Now, this kind of takes that conversation out of it, more so when you establish a recovery-friendly workplace. That's an employer saying, hey, I get it. I get it that employees are going to need a flexible schedule. They may need to go to mutual aid support groups. They may need to go to, outpatient programs. They may need to go to drug courts. So again, it's a win-win for everyone. As long as there's job vacancies, there'll be people with a substance use disorder and recovery that can fill those jobs, and we're just trying to put those two folks together.
But I'd like to just emphasize what Dennis said earlier in this hour, and that was that people in recovery make really good employees, and that they're highly motivated to work because it gives them the opportunity to get their lives back on track. And to have a normal life with stability and achieve financial stability as well. I think it's important to everybody, but certainly somebody who has to overcome a lot of things. And so I think they work harder. I've seen it in the past. And I've seen other minorities too. It may not have addiction or anything else, but are held back because of some minority situation. And the only way they can prove themselves is to work harder than everybody else. And, and that's, I believe that's true for these people who are in this program. So congratulations. And people should really think about that when they're about to hire someone.
Mm-hmm. Thank you so much, Dennis. Okay, I promised that we would end at a hard stop at 4:55, so I'm going to do my closeout now. First of all, thank you all. It's really a great coup to have our local chamber championing this particular initiative. We're grateful for your support. Dean, you've got that presentation down to a science. Now I know why. You just talked to every single chamber around. So he knows what he's talking about. Dennis, thank you so much for sharing your expertise. Dennis did not mention it today, I don't think, but he's an accountant, quite a good one from what I can tell. And that's just a bonus we got when we hired him. We hired him for his CERPA expertise, his certified recovery peer advocate expertise, and we got an accountant in the bargain, which is amazing. We have links to the evaluation forms for this session in the chat box. Please tell us what you thought, what you need. If you're curious about further exploring this, I will be sending out Dean's PowerPoint, right, Dean? That's cool. Say yes to everyone who registered for this session. We have a couple of other great sessions coming up, including one in 8 minutes that will be on, let's see now. It's going to be on the science of addiction, and it's a Narcan training. So you can get your Narcan training right now in 8 minutes. Tomorrow we have sessions at 12, 2, and 5. At noon, Shauna Has a Secret, Finding Evidence of Substance Use in a Simulation of a Teenager's Room. 2 o'clock, Harm Reduction, It Can Be Hard, But It Works, Evidence and Rewards by Michelle McElroy, the Deputy Director of the Southern Tier AIDS Program. And at 5 p.m., we have David McNamara, the Executive Director of Samadhi Community Recovery Center, David's Dennis's boss, talking about mindfulness-based recovery and his community center. We also have some great stuff on Friday. The role of law enforcement in recovery-friendly communities is happening in the morning. And then in the afternoon, a Project Ethico primary care physician will be talking about buprenorphine access. And then in the afternoon, a play about addiction with a panel that Dennis will be on, I believe. Join us for all of this. And we are so grateful for your attention. Do spread the word about this program. It's free money, and help us create recovery-friendly communities. Thanks to all our panelists. We're very grateful for you. And thanks to everyone who attended.